This presentation is an overview of the Continuum of Care system, the Texas Balance of State Continuum of Care specifically, Texas Homeless Network's role in that system, and the role of Continuum of Care general members. Every provider of homeless services, participant in homeless services, and anyone with an interest or stake in homeless services within the geographic boundary of the Texas Balance of State Continuum of Care is entitled to a say in how that system is run. By understanding the system better, stakeholders may be better able to understand their role within the Texas Balance of State Continuum of Care and how they can participate more fully in its governance. Let's start out by explaining what a continuum of care is. A continuum of care, or COC, is a collaborative approach to planning and funding. Continuum of care refers not only to the program run by the Department of Housing and Urban Development, or HUD, but also the geographic location covered by a COC program and the body of people that participate in homeless services within that geographic area, including service providers, advocates, local government officials, and community members. The COC program is governed by the Homeless Emergency Assistance and Rapid Transition to Housing Act Amendment to the McKinney-Vento Homeless Assistance Act of 2009, also referred to as the HEARTH Act. The HEARTH Act says that the purpose of a COC is to promote a community-wide commitment to the goal of ending homelessness, to provide funding for efforts by nonprofit providers and state and local governments to quickly rehouse homeless individuals and families while minimizing the trauma and dislocation caused to individuals, families, and communities by homelessness, to promote access to and effective utilization of mainstream programs and programs funded with state or local resources, and to optimize self-sufficiency among individuals and families experiencing homelessness. Requirements for the COC program are mandated by HUD through the COC Interim Rule. The COC Interim Rule states that a COC must, in short, establish a planning body and leadership structure for the COC, administer and operate a Homeless Management Information System, or HMIS, which is used to manage data about a homeless population, conduct COC planning and operations, and facilitate the application for federal COC program funding. Other videos in this series go into some of these topics in more detail. What is a balance of state? A balance of state, or BOS COC, is a COC that exists in parts of a state that are not covered by other COCs. In order to apply for HUD COC program funding, communities must be part of a COC. When the COC program was created, many communities, especially those in rural areas, didn't form their own COCs. One reason for this was a lack of infrastructure needed to administer the program. Balance of state COCs exist to help these communities apply for funding. The Texas Balance of State Continuum of Care, or TX BOS COC, was created in 2006. Establishing a BOS COC enabled agencies in areas of Texas that were not covered by their own COC to apply for COC program funding to address homelessness in their communities. Several existing Texas COCs also opted to join the Balance of State. The Texas Balance of State Continuum of Care is the largest of the 11 COCs in Texas. It covers 215 of Texas's 254 counties. All of the orange counties in the map are part of the TX BOS COC. What is a COC lead agency? Lead agencies are responsible for supporting COC planning, operations, and data collection, as mandated by the Hearth Act and the COC Program Interim Rule. As the designated lead agency of the TX BOS COC, Texas Homeless Network is tasked with assisting the COC board in ensuring that all COC requirements are fulfilled. Who is Texas Homeless Network? Texas Homeless Network, or THN, is an advocacy organization that was incorporated in 1991 to work towards ending and preventing homelessness around the state. In 1995, the Texas Interagency Council for Homelessness, or TISH, was created by the state of Texas to address the lack of COC funding in rural communities. THN received funding to help TISH fulfill its legislative mandates. THN later became the lead agency of the TX BOS COC at the request of the TX BOS COC board. Through a memorandum of understanding between the TX BOS COC board and the THN board, THN helps COC members to meet requirements of receiving funding, such as COC program funding and Emergency Solutions Grant, or ESG funding, develop housing crisis response systems in their communities, implement best practices for service delivery, and achieve high performance so that homelessness is prevented when possible, and when it occurs, it is rare, brief, and non-recurring. Who is considered a member of the TX BOS COC? The TX BOS COC governance structure is designed to allow the COC general members to act as the primary drivers of COC activities, in accordance with HUD guidelines. General member refers to anyone who lives and/or works within the COC and has an interest in preventing and ending homelessness. Some COCs restrict membership to those that meet certain criteria, such as paying annual dues or participating in general body meetings. The TX BOS COC has open membership, meaning that all those wishing to participate in COC activities are able to do so. COC general members elect representatives in the form of the COC board and COC committee members to make decisions about COC activities on their behalf. COC members are encouraged to participate by serving on and voting for COC committees, serving on and voting for the COC board, participating in COC general meetings, and submitting public comment on policy updates. More information about all of these activities can be found on the THN website, thn.org. If you'd like to learn more about the Texas Balance of State Continuum of Care, Texas Homeless Network, or have any questions, you can email txboscoc@thn.org. Thank you for listening.